Dr. Tiwary is going to talk about financial aspects. And once again, I think people were not here. So he practices in Bihar. So he deals with a lot of different kind of financial dynamics. So his talk would be very fruitful for the country like India.
Thank you so much, sir, for giving me opportunity in this instruction course. And I'm going to talk about financial implications of biosimilar. Finances are very important aspect of any drug. If a drug is costly, the uses are less, then we all know a phenomena in pharmacology known as orphan drug syndrome. It's just like if a drug is very costly and not used very commonly, there is no taker of that drug, and that drug generally gets out of market. Just we saw recently photodynamic therapy is no longer available, although many of its indication have gone into the backyard, but still we needed that treatment also, but due to financial things, that treatment is very less commonly available in our country. Biologics are very important, and their finances are much more important, because the development of biologics needs a huge budget, big finance, and then all those companies who invest so much on research and development, they want to take back that money once that treatment or that trial is successful. So the cost is very high, but that high cost impacts the success of treatment and the patients getting benefited from those biologics. Once that innovator biologics becomes off patent and that is open for any development of biosimilar, then here comes the role of biosimilar. And why they are important? Because biologics imparts a huge financial burden on any country. Forget about a country like India or a poor socio-economic state like Bihar, where I am practicing. Even finances are very important for developed countries like US, UK, European countries. That makes a huge burden on even their financial system also, NHS or whatever, private insurance and all. So for the safety purpose, as we all heard from Debdulal sir's talk, that first and foremost important thing for the success of any biosimilar is the safety and efficacy. Safety is the primary success criteria, and once it is safer, then efficacy comes into the role. Once biosimilar is safe and that effective, then comes the role of the finances. If it is financially viable, we have from our experience come to know that it reduces the treatment cost around 50% for any kind of patient. And where we are using these biosimilars, unfortunately, the treatment repetition is very high, like in neovascular AMD or diabetic macular edema or IPCV kind of patients, we need to inject more and more injections. So that burden is very high. Older publications also, so that on an average, at least one patient needs around 20 to 30 injections in neovascular AMD. In DME also, from drcr.net, we came to know that at least 13 to 15 injections are needed in a duration of 3 years to get a good result. So that imparts very big burden. In 2013 to 14, spending on specialty drug including biologics increased 32% in US, and small molecule drugs increased just 6.8%. So we can see why there is a huge burden of biologics. By 2016, 8 of 10 top selling drugs were biologics in US markets. In our country, why we face a challenge? Around 18 to 22% of Indian population is below poverty line. India's per capita income is very less as compared to developed country, and we are still a developing country. So it is a very big burden, and we cannot afford to spend that much on just health, and then all other sectors might be ignored. So the treatment costs are not covered. Many a times, if the treatment cost is very high, then insurance companies are reluctant to incorporate that reimbursement scheme into their system, or otherwise if they include, then the premium charges for the insurance goes very high. So again, the patient may not be affording that health insurance. So approximately 70% of our patients pay from their own pocket, and in underdeveloped part of the country like our part, that number or percentage is still very high. So there must be many dropout from the treatment, partial treatment, and then biosimilars here makes the medication affordable, help to reduce substantial cost burden to the patient. all the global coalition of regulator voices confidence in biosimilar, not only ophthalmology, from other all these rituximab, adalimumab, which we also rarely use in cases of resistant uveitic cases. So why biosimilar? Cost saving may translate into other associated benefits also. If the cost is going to reduce, it will have a impact on overall development of that industry or health industry as well. Reducing the cost of therapy will with increased compliance and success of treatment, a wider availability of treatment, and it will impact growth and development. And how it will impact the treatment regime also, there must be some newer development. Once that off-patent innovator is facing a challenge by biosimilar in terms of cost and market share, they are forced to work on newer molecule who are more efficacious, and they try to find out, and then we get new molecules which are more effective, and in that way the medical science grows. Many a times this availability of biosimilars at lower cost changes treatment preference as well. Like we remember when we were fellows, we used to do a lot of lasers to macular edema, even if center involving, and we see some of the microaneurysm and whatever, and if the patient is not affording anti-VEGF, okay, then you can undergo a laser treatment, focal laser, or you can take IVTA at the risk of development of cataract and raised intraocular pressure. But once these biosimilars have come, now we are almost switching to intravitreal injection of anti-VEGF for all kind of DME, and this laser and other things are just an adjunct treatment. So our treatment pattern also has changed with reducing cost burden of the treatment. Cost saving can be used to increase patient access to therapy also. Many a times if a patient is coming, he is very poor and there is no treatment option available, the patient is lost to follow-up, and even we are helpless to offer them any help in terms of treatment. So if the treatment cost is reduced, more and more patient can be benefited. Another thing, if a patient is developing some early mild edema, and if they are not affording, we would try to wait, okay, you just control your diabetes and we will see what is happening, and they may come in 3 to 6 months with a big edema. So but if the cost is lesser, we may try to start the treatment early, and then the results are good and the outcome becomes better. It has increased healthcare personnel as well. Reducing cost of the treatment has increased the number of healthcare professionals learning the technique of intravitreal injection, learning the technique of interpreting OCT scans, and learning the indications of the treatment. And now we have seen that majority of our friends who were practicing in lower strata cities, smaller towns, where they were not using anti-VEGFs or biologics as they were high-cost treatment, and they were little bit hesitant that if I am going to inject a 50,000-60,000 injection, if the response is not good, then I may not be able to explain the patient. But once the treatment cost has come down, the confidence of patient as well as our colleagues have grown, and now the treatment has become widely available across the country. So that was the impact of reducing financial burden due to biosimilar. Cost effectiveness. The lower prices of biosimilar definitely improve cost effectiveness. Cost of therapy of individual and financial burden of government is also reduced, and that impact is transferred on the finance, growth and development of the country as well. Reimbursement, that is a very important thing. All third-party administrators are now willing to approve all these daycare treatment facility of intravitreal injections, because the drug cost has reduced, the procedure charge has reduced. So now they are including this reimbursement of injections in their scheme, and still that premium remains lower side. So more and more patient can afford through TPA. Even government is also now willing to accommodate all these costly injections, because the cost has come down in their social welfare schemes like Ayushman Bharat. Now anti-VEGF is also approved in Ayushman Bharat. So very poor patients who can never afford on their own pocket also, they can get the benefit of this social welfare scheme. Just because the cost of drug has come down, even government can afford to offer to the poor class of the country. So this improves compliance and success of treatment. So thank you so much for your kind attention. Thank you.
Thank you, Dr. Tiwary. So it was, very nice to highlight. And I especially took one point, which was quite striking, that we have been now seeing that a lot of people in the second tier city, third tier city, they want to learn anti-VEGF, because previously it was a costly therapy and people were definitely, as he said, they were thinking that, if I counsel for an injection of 20-25,000, then if patient does not improve, then it impacts my practice. So that fear has come down, means that's what a great implication, which biosimilars are meant for, to increase the access of this therapy to more and more people. So that's great. I have one question, Dr. Tiwary, means you deal with a lot of patients, a lot of patients from surrounding areas from Patna, they come, how do you counsel about biosimilars?
See, whenever I'm explaining them, we have to give all the options, because we never know which patient is going for what injection and what is their pocket just by the appearance. So we do explain that this is the injection which is being manufactured and marketed by international agency or international company, but this one is exactly the same molecule and it is being used for a longer time, and there is no difference between the two. The cost is lesser because it has been developed in India and it is being marketed in India. So the cost of therapy is lesser. In our experience also, we do not see any difference between these two. So whatever your budget allows, you can opt, but practically there is no difference, and these two molecules are approved also in India. So you can go for, and majority of our patients do opt for biosimilar, and we are also happy that we are giving them good treatment at lower cost.
Do you had ever had any questions coming back from a patient that can you tell me the difference, that with just India?
Yeah, they do ask, because the cost of the treatment is around 8,000 to 10,000 extra in innovator and biosimilar. So they do almost always they ask that if these two are same, why the cost is more. I just say that this is imported from outside country, so definitely the cost is going to be higher. Otherwise, there is no difference.
Dr. Dogra, you have a different kind of practice in a different kind of setup. So do you get this challenge in terms of disbelief on biosimilars?
I think one of the additional thing which we always must explain once we put patients on anti-VEGF is the long-term treatment and multiple injections.
Yes, sir, yes.
I think once we talk about that, and then they look at the entire cost and everything, and once you already said that the two drugs having similar efficacy and safety, which has been proven now. So I think that part is also very important. Yes. Once they calculate that, and we have most of the diseases where the drug would continue for a very long time, I think they get very well convinced. And that is another point we should keep in mind, and not tell them just 3 injection lagenge. No. That is a problem with many of our people, those who are not seriously into this. So then it is a problem. That's what.
So point means very well highlighted by Dr. Sir, because if we tell them from the beginning that this is the spectrum we are looking for a year, then probably that cost runs in the brain. Otherwise, if just we start treating in the beginning, then probably that math is little different. So means sir has a practice of a little more educated audience, means I would say educated patients. You have ever had any kind of patient who is saying means I have a little less belief on this cheap therapy?
Not really. I think it depends again on your counseling, which is very important, because since I came from absolutely a government institution where we had different strata to something which after my superannuation to a practice which is a little different. But I think it's amazing. I'll show you some data also, that even in an institute where I work, where many of the elite people come, they want Razumab, because they know it that they have to spend even for so many years. So it's fine. I mean, a lot of our AMD patients, I would say, diabetic patients, because they require injections a lot. So they want this. So I think there's a big change,
Great.
I must say.